So again, good afternoon, good morning, wherever you are joining from. Um, Super excited to have you all joining this presentation today. Our webinar titled How Education Institutions and Community-Based Organizations Use Home Visits to Strengthen Connections with Newcomer and Immigrant Families. And I'm very pleased to be working with the Institute for Educational Leadership as a partner in presenting this information to you here today. My name is Anthony Salas, and I'm the Senior Manager of Events and Membership with Welcoming America. And just very quickly, before we get too far into things, just a few quick housekeeping items for you. As you know, and you've been using, the chat feature is enabled. As we go through the presentation, you can use this for any sort of technical assistance you might need help with, anything related to the platform. If you have questions about the content during the presentation, feel free to use the Q&A feature and enter your questions there at any point as the presentation goes on. And we will have a formal Q&A period at the end of the presentation, and we'll address those questions there. But again, if you can use content questions in the Q&A portion, that would be great. And if anyone needs to utilize the closed caption feature, it is enabled. Again, it is along the toolbar. If you don't see it, there is a more button with some three little dots. You click that and you should be able to enable it from there. And of course, the webinar is being recorded, so we will be sharing this out with you all in the next few days. It'll be going out to all of you as attendees, but also individuals that if you can't stay on for the full time, you'll get the full recording. And if anyone isn't joining, they will get it as well. So that'll be coming your way in the next few days. So now, again, very excited to have Sabrina Sheikh joining us here today. If you joined us for our July webinar, Sabrina was just an amazing partner with IEL working with us. She is the Immigrant and Refugee Leadership Coordinator with IEL. She and I have worked together now for a while, and I'm thrilled to have her as a partner and consider her a great friend as well. So at this point, I'm going to turn things over to her to get us started.
Yes, good afternoon. As Anthony said, my name is Sabrina Sheikh. I'm with the Institute for Educational Leadership. We are a national nonprofit that's located in Washington, D.C., that does work around the intersection of education and workforce development. And today we are here for a very exciting conversation, and we have an amazing panelist lined up for you all to really hone us in on this space today and really set the stage around the topic of home visits. I actually want to start off with Gina Martinez, who is the Executive Director at Parent Teacher Home Visits, to really set the stage, as I said, around the importance of home visits and the impact that it makes before we actually go to our panelist conversation.
All right, thank you so much, Sabrina. And if we could go to the next slide. As Sabrina said, my name is Gina Martinez-Ketty. I am the Executive Director of Parent Teacher Home Visits. And I'm so thankful for IEL and Welcoming America for hosting us today, because it's not often that we get to do a webinar strictly on home visits, and then on top of that with immigrant and newcomer communities. So thank you for that. During this segment, I'm going to be doing three things. One of them, I'm going to just share some reflections about home visits in general. And then secondly, I'm going to offer up some considerations for doing home visits with immigrant and newcomer families in particular. And then I'm going to share a little bit more detail about parent-teacher home visits. So let's go ahead and get started. So when we think about home visits generally, if you could put yourself in the shoes of a parent or caregiver of a school-age child, and imagine that the child's teacher calls you up and says they would like to come to your home and have a little chat. What are some things that are going through your head at that time? If you want to put something in the chat box, you can do that. So what are the assumptions that are going through your head when you get that phone call? Anthony, if you want to click the next section here, the next button. if you're anything like me and a lot of other people out there, some of the things you might be assuming is that there's something wrong. Your child did something, is in trouble, or me as a parent or caregiver, I'm in trouble, I did something wrong, and the experts at the school are going to come over and they're going to look at my house, they're going to inspect it, and they're going to tell me everything I did wrong, and they're going to tell me what I should be doing instead. So in general, I think a lot of us hold these assumptions that home visits are punitive in nature, and for very good reason, because I think historically some home visits have in fact been punitive in nature. And so we get these assumptions from actual experiences that some of us have had. So that is just one thing to keep in mind as you're thinking about inviting a family, any family, to do home visits. And then if we go to the next slide, there are also additional layers of experiences that immigrants and newcomers bring to the home visit experience. And so these are some additional considerations to think about when you're interested in doing home visits with immigrant and newcomer families. So Anthony, you want to click the next button? So the first one is to keep in mind that immigrant and newcomer families might be coming from a community where the educational system is very different from ours, or very, very different from yours in your community, right? And so just to be aware of those differences, they might not be familiar with some of the common expectations at your school. Secondly, remember also that immigrant and newcomer families are often trying to navigate other kinds of systems, whether it's a healthcare system, economic system, an immigration system. They've got all those additional layers at play in their daily lives. The third one, I saw some of you put it in the chat box, is language. Not all immigrant and newcomer communities or families are going to come to your community with English fluency, right? Some of them might, some might not. And so be aware of that. And if you need to take some action in finding an interpreter, make sure that you do that so you can have that conversation. But also, even if families do speak English fluently, sometimes they might not be familiar with the language of school, the jargon, the acronyms, right? All of those things. So keep that in mind as well. And then fourth is expectation. So again, they might be coming from a home community where the expectation between school and family might be different from the expectation between home and family in your community. Okay, so again, something else to consider. And then the fifth one is social support network. So, or any support network really. Some immigrant and newcomer families might have come to your community with a network already established, and others might have come on their own and do not yet have that kind of network established, okay? And then last but not least, and I'm sure you all can add lots of other considerations to this list, but the last one here is to consider the risks that the family may have taken to journey to your community, okay? And those can have long-lasting effects. And also consider the day-to-day risks that some immigrant and newcomer families have every day in the community where they've resettled. So these are all some of the things, in addition to those common assumptions, these are all some things to consider when you're thinking about doing home visits with immigrant and newcomer communities. Let's go to the next slide. And fortunately, not all home visits are created equal. And I'm proud to say that the panelists today are going to be talking about a different kind of home visit. And I hope and I like to think that we're moving in the direction away from the punitive home visits toward a partnership model of home visits. And that's what we're going to be focusing on today. And so I just wanted to pull out some common threads of what these partnership home visits can look like. So first of all, obviously, we want to prioritize relationships of trust and creating that sense of partnership. I always say that when you have that foundation of trust, probably everything else is going to work a whole lot better. And so really pay attention to that relationship. And then also honor each family's uniqueness. And so definitely we want to recognize that families come from communities with rich histories and practices and traditions. And we also want to recognize that within those patterns, that each family is going to be unique. And so how do we really go into a home visit to honor that uniqueness and learn about it? The third one is to adopt an assets-based mindset. To go into the home visit really, really knowing and believing that every single family, every single member of the family has assets, has strengths, has wisdom that they can share and that you can learn from to better support that child in school and out of school. Which leads to the next one, is to be a listener and a learner. And so again, rather than the old style of home visit where you're going in as the expert to impart all your expert knowledge on the family, you're really going into that home visit to learn from them. What has their experience been like? What are some of the successes and challenges that they face on a day-to-day basis? What do they enjoy doing as a family? What motivates that child, right? So really keep your ears open and really be curious about learning about that family and who they are. And then the next one is, take stock the best you can, take stock of your biases and assumptions, right? So before going into that home visit, take a good long look in the mirror and really try to surface what assumptions, what biases might I be bringing into this home visit that might prevent me from really listening and learning about this family. We all have biases and assumptions, right? Every single one of us. And so I think it's important to do our best to try to surface them before the home visit, and then do our best to try to leave them at the door before we actually go into that home visit. So we're open to learning. And then the last one is to remember that, when we talk about relationship building with families, relationships are reciprocal, right? And so even though you're asking questions and you want to listen and learn about that family, it's important to remember to also share a little bit about who you are, right? Share a little bit about your story, your experiences, what you like to do in your free time. What is your immigration story if you have one? By sharing a little bit of who you are, you're building that reciprocal relationship, but you're also beginning to level the playing field a little bit so that you're offering some vulnerability just like they are in sharing their story with you, okay? So let's go to the next slide. So that's just a little summary, again, some opening reflections and thoughts on home visits in general and with home visits with newcomer and immigrant families. What I'm going to do now is share a little bit more detail about parent-teacher home visits and our model of relationship building home visits. So parent-teacher home visits at its core is all about building relationships of trust between families and schools. And we do that by providing training to educators on how to use our model of home visit. So next slide. Parent-teacher home visits was started about 26 years ago in Sacramento, California, and it started as a collaborative effort between the local community organization, the local teachers union, and the local school district. And they really were clear that they wanted to build stronger relationships between families and schools. And so they launched home visits in 1998 with 8 schools in Sacramento, California. And then the next slide shows that in those intervening years, we have grown quite a bit. So we have now trained in 28 states plus Washington, D.C. and Saskatchewan, Canada. And during the 21-22 school year, our parent-teacher home visitors from across the country did more than 30,000 home visits just in that one year. So the next slide will share a little bit about what our model is. Okay, so What you see here are what we call our 5 non-negotiable core practices. And we always say that if you want to practice the parent-teacher home visit model, these are the 5 things that we ask you to do. And outside of these 5 things, there's quite a bit of flexibility to adapt the practice to your local community. So very quickly going through these, the first one is that educators are trained and compensated. So I mentioned earlier that parent-teacher home visits provides that training. But we also want to make sure that school districts compensate educators for their home visit time, to really honor their time. The next one is that visits are voluntary for educators and they're voluntary for families. And so nobody will ever be mandated to do a parent-teacher home visit because they're always going to be voluntary. And then the third one is that this model of home visits was really designed to benefit all students, not just the students that are struggling, not just the students that might be thriving in school, not just the students for whatever, that fall into any other category that we have in schools, but really designed for all students or for a representative cross-section of students. And then the next one, and this is what I really think of as the heart of our model, is that in every first home visit, we always ask the educators to ask the family, what are your hopes and dreams for your child? And as you can imagine, that begins to open up a whole different kind of conversation between the family and the educator, and they begin to create a shared vision to work toward together in partnership. And then the last one is that educators go in pairs. So we always have 2 educators going on home visits together. And then we always ask them to spend a little bit of time after the home visit reflecting together on what they learned during the visit that they can then take back into their teaching practice to better support that student. Okay. So the next slide shows the research coming out of this model. So a few years ago, we did a national evaluation of the parent-teacher home visits model. It was done by RTI International and Johns Hopkins University. And what they found is that the parent-teacher home visit model definitely strengthens the relationships between families and educators. It increases ongoing communication and it increases confidence in both of them to reach out to each other on a more regular basis, just to share what might be going on at home or at school that might impact that student's learning. It also changes mindsets about each other. So it shifts the way they think about each other. They begin to see each other more as true partners, as co-educators for that child. And then student outcomes, they found that students who received a home visit showed significant decreases in chronic absence rates and significant increases in academic achievement, particularly English language arts, and showed improved behavior as well for students that received a home visit. What they further found is that when schools implement parent-teacher home visits with at least 10% of their students, they begin to see similar decreases in chronic absence and increases in academic achievement at the whole school level. So even students that did not receive a home visit showed those same kinds of outcomes. And then next slide. So what I've given you is just a very brief, in a nutshell, parent-teacher home visits. This is my contact information. If anybody wants more information, I'm always happy to talk more. So with that, I'm going to hand it back over to Sabrina.
Thank you so much for sharing that information, Gina. And I think what was really like some of the highlights that I see, right, is that, shifting the mindsets around how we see home visits in the first place, where it's not just punitive and your child did something wrong and that's why we're doing a whole visit, but we're shifting our mindset of we see it as a partnership. It's not transactional where we're just going and taking from families, but it's actually leading to transformational where we're co-creating and we're co-partnering with our families and we're seeing both the assets that, families have to offer into this space and as well as educators as well. And then just by the research findings, right, like it's going to have the impact you want when you actually center it around that relationship building and really around those pieces of like, how do you really think about this specific population of youth and families that we're supporting when it comes to like immigrant and newcomer families and youth, and what is the steps and the things you should be considering and thinking about when you're even from the moment you think about having a home visit to actually conducting the home visit and how it should actually go when it's happening, right? So thank you so much for that, Gina. And now Gina will actually join our panelist conversation. And so I want to give an opportunity to my other two amazing panelists to introduce themselves before we hop on into the questions.
Hi, good afternoon. Buenas tardes. I'm Carrie Richardson. My pronouns are she, her, hers. I am a bilingual teacher at Denver Public Schools. I've been at Denver Public Schools since 2007. And that entire career, I've been working with immigrants or children of immigrants. And currently I have the great honor of working at Place Bridge Academy and working with newcomer students, 3rd through 5th grade, who have limited schooling. And so they're new to the country and they have limited schooling in their home country or in their home language. I've been doing home visits since 2013, and specifically through the PTHV program that Gina is talking about. So I'm a huge advocate for that. I'm excited to be here.
Thank you, Carrie. And then how about you, Dr. Michael Gary?
So good afternoon, everybody. My name is Dr. Michael Gary. I'm the Chief of Staff for Concentric Educational Solutions. Everybody, please feel free to call me Mike. Concentric Educational Solutions is a student support organization that has been around since 2010, with home visits being our primary or our core service offerings. The organization unfortunately started in response to a tragedy, the Benita Jax tragedy that happened some time ago in Washington, D.C., where we had 4 students who were siblings, 4 girls. They attended 4 different schools, who were missing from school for months, and nobody knocked on their door. And unfortunately, they died, right? The work that we do is really targeting identifying the barriers that impact students' willingness and ability to fully engage in school. So just like Gina said, our home visit approach it's not punitive at all. We're simply trying to find out what the barriers are so that we can connect students and families to the resources they need so that they can be successful.
With that, Mike, I actually want to start off the first question with you. Since I know, Gina, you talked a little bit about the model you all have, and I would love for you to add any additional information. But Mike, with concentric ed, right, I know there's a particular framework that you all use. So can you actually give some highlights around the framework that you all use to conduct home visits?
So everybody does home visits. So home visits is not a new phenomenon, right? But what we say at Concentric, just like what happens with the parent-teacher home visits, is that you need to apply a methodology that's going to guide the way that you engage home visits as an intervention. So we have the 5-step home visit framework, which starts with a pre-visit meeting. We want to know the purpose of the visit, right? We want to have conversations around previous interventions that have been used to provide support for the students and the families that are in our schools. And then we determine if the home visit is the best approach, right? We want to ask questions around, do we know if the address is correct? What was the last point of contact? Did you see somebody at Walmart, right? Then in step 2, we're going to go and conduct the home visit. And during the home visit, we're again trying to identify those barriers that exist. We may come and use home visits to deliver information, but nonetheless, we have an understanding of why we're there as a result of the pre-visit meeting. And we document the outcomes of the home visit in our home visit and student engagement app. I've been with Concentric for 5 years. And when I started, we used to document in spreadsheets like many of you, but it was driving me nuts. So I said we needed to do something else. So we created an app where we can aggregate the outcomes of home visits so schools can use that information to properly plan their supports around their students. After we do the home visit, we go into step 3, which is a post-visit meeting. We want to talk about what we learned, right? So we're forcing schools to go back to the individual level of the student, have a good understanding of their story so that they can provide the most appropriate support. Steps 4 and 5 go hand in hand. And what we're doing in step 4 is monitoring when the student may have returned or had a change in behavior. And then in step 5, where we return back to the MTSS framework that many of you are familiar with, when we're tiering the student support. And so that's our five-step home visit framework.
Thank you so much for sharing that, Mike. And anything that you wanted to add, Gina, for the model that you all have at Parent-Teacher Home Visit?
I'll just add something that actually Mike reminded me of is that I love that you do kind of the pre-work, because in our model also we always say that we don't want to do a drop-in, like take the family by surprise, right? So all of our home visits are pre-scheduled in advance, set up in advance with the family, so there are no surprises and they know people are coming, they know what the purpose is ahead of time. The other thing I'll say is that we do have a 2-visit model where the first visit is purely relationship building, as I discussed earlier, and then which then leads to ongoing communication. And then a second visit can be a little bit more focused on perhaps an academic topic that you want to focus on, or some other kind of focus that is needed.
Thank you so much for sharing that, Gina. So our next question is really, what are the strategies or approaches have you all found to be most effective in building trust and rapport with newcomer and immigrant families during the actual home visits? And I don't know, Carrie, if you want to kick us off.
I mean, you know, I'll talk on this all day, but yeah, I mean, I really want to just go back to what Gina said. She said, leave your biases at the door. And I think that's just the first step. Go with an open mind. There's just no judgment. And that just opens you up to that rapport and that trust. I think the other thing is what Gina just mentioned, which is I'm not just stopping by. I make an appointment. I call the day before to confirm the appointment, make sure that it's still okay. And from there, it's showing true joy of being allowed into this family's home, which if you don't feel the joy, maybe schedule it for another day, but you got to go in with joy and love for the families and for the students. You have the student in common with the family, so you already have a point of connection. And so when they see the connection that you have with their child, then they are going to be able to open up in trust as well.
So one of the things that's important, again, is before the home visit. Before we go and knock on the door, we need to make sure, again, reverting back to what Gina suggests, is check our biases, right? So we need to understand the communities that we serve and the nuances that are associated with those communities. One of the things that David, our CEO, always says is before we start working with a school district, we need to know the community. So we go and canvas. We kind of take the ethnographic approach because we want to know how many McDonald's are around, where people are hanging out, how does the environment feel before we start engaging with the school, before we and then before we go and knock on the door. So we want to make sure that when partnering with schools and school districts is that there's some information that's sent out that informing families that home visits are going to be used, right? And why we're coming. Because again, we don't want to surprise a person when we're knocking on the door in a way that they haven't been previously informed. And then other things we need to consider is the religions that are present in the school districts that we serve, any religious holidays, like, for example, are we going out during Ramadan, right? And does that impact our way that we're able to engage with our Muslim or our Islamic families? So a lot of it is the pre-work, the pre-communication before we start knocking on the door, so parents know that we considered them first.
And to piggyback on that, my Dr. Gary, you told me to call him Mike.
Yeah, Mike, please.
Another really important piece is that if it is a refugee or asylum seeking family, they will usually have a caseworker and often a family advocate. So just a volunteer from the community. And so it's really great to get in with those people, especially those family advocates, because if you can arrange to meet that family advocate at the home at the same time, they've been to the home before, the family knows that person, and that person can also give you heads up on anything. And we'll talk more about kind of the culturally responsive and sensitive piece, but those family advocates that already have been to the family's home are a really good resource.
And one of the things that we learned is that we need to be easily identified as a part of something education related, right? So, our attire, if it's the summertime, we have on, our uniform or our branded shirts, so that people know when we knock on the door that it's somebody from the school. Now that we have a fleet of vehicles, there's big signage that says when we're driving up the concentric educational solutions, so that there is no mistake about why we're there, right? So if you all are using the parent-teacher model, then you would want to make sure that you're wearing the gear that comes from your school, because families are going to be looking and they're going to recognize that. I've done many home visits where they're being concerned, and these families weren't even, they had, they weren't immigrants. They lived here. They were citizens of the United States, but they still had concerns around ICE when I'm knocking on the door, right? So, because I was easily identified as a part of the school, then they were more welcoming and more willing to participate in the home visit experience.
Yeah, I just want to put a pin in that. Thank you for raising that. I think it raises the question too, and the need to really communicate school-wide what it is you're doing, why you're doing it, and to communicate what you want to do in multiple ways and multiple times, right? Because we don't always get the message on the first go around, right? And people hear messages in different ways. And so to make sure to communicate to families and to your school staff about the purpose of your home visits and what to expect and why you're doing them, and all of that will help ease the way as well as what Mike was saying about making sure you're representing the school when you get there.
Sabrina,
no, thank you. Go ahead, Mike.
So, and I was just thinking about something else about trust, right? So if you have a culturally relevant or a culturally connected community in the school, right, that's helpful. So typically what I see is when we have Spanish speaking families, for example, we use every Spanish speaking person in the building to connect with the Spanish speaking family. That's not only their responsibility, right? So I, as a Black man, should be able to connect and build relationships with Spanish-speaking families. I may have a language barrier, but as the educator, in this sense, it's on me to find pathways by which we're able to connect despite the language barrier. So we just want to be careful about overloading people because they're of the same culture or of the same ethnicity when it's everybody's responsibility.
100%. No, thank you all for sharing that. I think some things I really wanted to highlight, right? And you talked about this when you were talking about the model, was that pre-work. So as we think about building relationship, building trust with our families that we're about to go visit, right? We need to actually know, like, what family am I going into? What's their background, right? Is it Ramadan? Like, is it fasting, right? Like, should I be going into this person's home at 7 o'clock or 8 o'clock when they're about to be breaking fast? They are not going to be present for this conversation, right? Being able to like call the families ahead of time saying, hey, we're coming. And even that attire piece that you wouldn't even think of, right? Because you're like, they know I'm coming, but like, how are we conscientious of it and seeing how our families are going to react to it, knowing everything that is going on, right? And so it's not just about knowing about the family, but like knowing what's happening in society and how those impact families. Therefore, how should we be going about it in this current time, right? When we are hoping to conduct a home visit with our families. So thank you all for sharing that. Going on to the next question is really, how do you all handle situations where language barriers exist during home visits? And what are some strategies you found effective in bridging these these communication gaps?
So for me, I'm English speaking, and of course, I've had my K through 12 education experience with learning Spanish. So there's definitely a gap there, right? So, in using this as an opportunity to build a relationship with a family, I'm seeking their help, right? The benefit of the home visit is that we're knocking on their door and they're in a safe space. Typically, we're using parent and family involvement in school, whether public or private, parent and family involvement, where we're pulling them into the school, and then there may be an imbalance there. So if I am speaking with a Spanish speaking family, for example, I'm also giving them an opportunity to help lead the conversation. When a language link is not available via the school district where we're partnering, of course, I'm using Google Translate or other translation services that are on the spot when we don't have, a person that speaks that language. And to be honest, you really can't solve that because we have school districts with 173 languages that are in one space. So, there's going to be times where you don't speak the language of the family that you visit, but the effort goes a long way to try to get them to speak their language as opposed to getting them to speak yours.
One thing that is part of the parent-teacher home visit program is that you always go with another person. And the purpose for that is, there are many purposes. One is you're making sure that more than just one adult is making a relationship with that family. And it's also for safety, of course. But not to overburden one particular colleague, as Dr. Gary really pointed out, but my first choice would be going with a colleague who speaks that language. That person can also often give heads up on different cultural practices that I should be aware of. Second choice would be a professional interpreter meeting me at the home. I've done that with a Kinyarwanda interpreter. I can't even tell you how positive the experience was. He ended up setting up the family's Wi-Fi for them, in addition to making sure that our conversation was absolutely understood. Third would be language link on the phone. So you can just get language link interpreters on the phone. That is my third choice. Fourth choice would be something like Google Translate, if you really need to. Bear in mind that many immigrant and newcomer families, especially the ones I work with, the families themselves, the parents, the adults in the house may have very limited schooling themselves. I have several families who are not able to read and write in their first 2 or 3 languages. So Google Translate is like low on the list, especially if it doesn't have a function where it will speak the translation. It will say out loud the translation.
And we also consider
Go ahead.
colloquialisms, right? So I'm from Philly, and we have our colloquialisms in Philly that we use, like join or drawing or something like that, right? So, in other languages, there are colloquialisms that don't necessarily translate over from the formal teaching. So, you're spot on, Carrie, when you talk about, being careful about the translation services that you use with our families, because they may, we may be translating formally structured conjugated vowels in our translations, and the families that we're supporting just don't speak that way, right? So again, creating an opportunity when they can lead the conversation. You can say, I often say, oh, I'm not that good at this particular language, but help me out with this, keeping the conversation very simple and direct and to the point and not so complex, so that we can at least get the information that we need and then connect them with somebody that could have a more full, robust conversation using the native language.
That was exactly what I was going to say next.
Reading your mind.
When you're sending an email or writing a letter or speaking, you got to communicate with translation in mind. So, of course, avoiding like idioms and colloquialisms, really keeping sentence structure simple, and avoiding that jargon. Absolutely. That can help you even if you don't even have a translator with you. if all of a sudden you're there, you don't even have anybody to help you, speaking with that in mind, simple terms, simple phrases, using things that you know somebody's going to know. So for example, if I'm going to say, I just came from the store, I might say something like Walmart. So Walmart is a word that's going to be the same in every language, whereas store is going to have 138 different translations.
Right.
So choosing my words like that, in addition to all of the other things that Dr. Gary just mentioned as well.
Yeah, I just want to chime in here too that, one of the most powerful home visit stories that I've heard was from a teacher who went to do a home visit with a family that spoke extremely little English. And so they kind of struggled, and she wasn't able to find an interpreter, but they kind of struggled through with, as Carrie said, a few key phrases. And but by the end of the home visit, this teacher described this moment where the mother put her hands on the teacher's shoulders and looked her straight in the eye and said, like, thank you, or something like that. And they just had this moment of recognition that we built a relationship of trust here, even though we couldn't necessarily communicate in the same language. And so, it is about building a relationship, and you can do that. Ideally you can do that with, language, but sometimes there are nonverbal things also that can contribute to that relationship.
And that is coming back to what you said at the beginning, Gina, when you were talking about like share a story, get a story. I think sometimes sharing a photo on my phone goes a long way to building that rapport and helping with that language barrier. So if grandma lives in the home, I'm going to show them a picture of my mom on my phone and be like, hey, this is my mom, and my mom's important to me. Or if auntie lives in the house, here's a picture of my auntie. I have an auntie too. So just kind of, I think that also kind of lowers some of those affective barriers as well as the language barriers. I mean, family, we get family. Everybody understands what that is. So finding those connections as well, and love having a smartphone for that purpose.
And don't make any assumptions. So I had to, yes, I'm a chief and I do home visits. Gotta be connected to what's on the ground, right? I did one home visit for a school in Baltimore where they said that the family was Swahili, right? And no one spoke English. And they really believed that no one spoke English in the house. And I got there and it was somebody that spoke full English. So, don't make any assumptions because the family may be immigrant about their inabilities, right? To fully integrate, right? So again, make sure that you're removing your biases and be open and prepared to engage whatever comes before you.
And I have found that last thing seriously is what you're saying, Mike, is that, the preferred language is Bembe, right? And Bembe translation is not something that we can find. But it turns out that the dad speaks French and the mom speaks Swahili. So if I can find a Swahili interpreter or a French interpreter, I can communicate with one parent. The parent then translates it into Bembe. I've had that with Pashto and Dari. I've had it with Swahili, French, Moore. So many families are multilingual. So I can always ask, okay, so, and I saw in the chat, some of these languages, it's really, really hard to find resources for. But often the families know more than one language. It might not be their first language, which would be our first choice, but definitely thinking outside the box.
Yep.
100%. And some things I wanted to highlight from what you all said was definitely that body language piece, right? And I think it goes back to trust and how do you build trust? Oftentimes, if you're coming into a home with a negative perspective, or you're in a neighborhood that you're I don't feel comfortable, or for whatever reason, right? Your body language is going to show a lot. And so how are you coming into a home with a good body language that you want to be there? You want to learn from this family, you're excited to meet them, because that's going to really set the stage for that continued conversation for that home visit. And so really paying attention to that body language piece, I think it's like really center, because I know we're always thinking about just the actual us speaking and that, you know, like how do I communicate with this family, but don't take away the power of like your body language speaks a lot for you as well. And I think in addition, really thinking about, I will say, right, it's always great and nice to have someone that speaks a specific language that you're going into a home. And so how do you also think creatively of like, there's a lot of community-based organizations that, you know, are there within your community. And so even if you can't get a translator that day or for whatever reason, how can you also rely on some of those organizations that are already doing similar services or supporting people from that particular background to call them in with you to actually support you in those home visits are also important too, right? So that families do have someone that they can also communicate with if possible. At the end of the day, we know that reality is it's not going to always be the case, but if we can make it, and I think that's where going back to models, right? Like if we can do it in our pre-work and recognize that this is a language we don't have and figuring out at that point, who can I bring in to make that, you know, home visit a lot more conducive, then go ahead and do that. And when it's not possible. And that's where we get to the, you know, using Google Translate and other different applications right on our phones, but really try to do all those things beforehand so you can really ensure that your home visit is really successful and you're able to like conversate with your families. And also there's students sometimes as well in that space. So think about it like you also know the student that you may be going into their home. And sometimes you can also rely on them and to support in that translation as well. But going on to my next, anything to, okay.
No, I was just going to say the resource map. So when we're talking about that pre-work, when we're developing the resource map, we can include in that document translation services. So if there are community partners that can help with translation services, then, you know, the families can already know beforehand who they can partner with and who we will be partnering with to help facilitate those conversations.
And asking those questions around dialects, right? So for example, I'm Somali, we speak multiple different dialects, and I've been in various meetings when I used to do home visits around like, okay, you're from this part of Somalia, what's your dialect that you speak, and trying to bring someone, if possible, knowing that even within that, I couldn't always do that. And so I think even as we're thinking about language is how are we even asking the deeper questions around like, what is the, you know, your preferred dialect that you speak? Or is there other languages that are spoken in the house, right, than just one? But those are just things to consider. With that, going to our next question is really around how can schools and organizations ensure that home visits are culturally sensitive and respectful of the various backgrounds of the families they serve? I know we kind of touched upon it as we've been going through this webinar, but love to have you guys go deeper.
I mean, yeah, we have touched on a lot of it. I think one thing I wanted to say that could go with any of the previous questions is I don't bring paper. Like I do not bring a clipboard, do not bring paper. If you need to get proof of a home visit, you can have a piece of paper in your pocket, but I'm not going in there with a piece of paper because that is looking like a checklist, like I'm here to judge and I'm here to see how dusty is your TV. Like I'm not in there for that. So I don't bring any paper. The scheduling piece is really important, knowing about holidays, knowing about Ramadan. It's not a good time to schedule a home visit with a Muslim family. I think also just knowing culturally that I can't think of a family, an immigrant family or a newcomer family that hasn't wanted to feed me. So that is part of the pre-work that I do, is just setting expectations around that. They're going to want to give me all the food in the world. And finally, just really making sure that the purpose of the visit is shared with interpretation beforehand, so that it's absolutely what they're expecting. And I know we have more to say, but I'll stop there at the moment.
Right. So, definitely having an understanding of who's present within your community and then providing the culturally sensitive training beforehand, right before you go out. So, uh, we talk about in our 5-step framework a pre-visit meeting, but really it is a pre-visit experience, right? So what does training look like for your staff that is going on throughout the year, right? Or every year pre the beginning of the school year, where you're saying, look, this is who our student body represents, right? You may look at the gender split, you may look at the ethnicity split, the language split. All of that data there is going to tell you what information you need to know about your students before you start knocking on the door. So for me, this is the way that I look at it. I look at it like this: numbers, story, then interventions. So that means you want to start with the data, the quantitative, then have a conversation around the qualitative. So you really get to the root of the lived experience of our students, right? And then you decide whether or not you're going to conduct a home visit or what kind of intervention is going to be best to meet the needs, because you may have families where home visits are never an option, right? They may opt out of the home visit altogether, and but we still have to find ways to connect, embrace, and support those people or those families.
Yeah, I want to add something here too, that I think I completely agree 100% that we need to know as much as we can about the cultural traditions of the families that we visit. I will also say that one of the fears that I hear from educators being trained to prepare for home visits is that they're going to do something to offend the family. And so I think there's a balance between being aware and being authentic and being respectful, and knowing that you don't have to write a dissertation on that family's cultural traditions to be able to go do a home visit. Like you definitely need to know some of the basics and know how to respect that family. But it's also okay to go in there not knowing and going in, like I said earlier, as a learner and learning about what their traditions are. So I think there's a balance somewhere in there.
I agree 100%, Gina. And I want to speak to that fear as well. And I think that kind of goes into some of the barriers that we may discuss later on, but the challenges. But I think the first time I went into a particular family's home, I just said, "Oh my gosh, you have such a beautiful family," which was a faux pas, unless I follow that up with Alhamdulillah, right? So thanks to God that you have such a beautiful family, because if I'm complimenting you without saying that, it's a faux pas. But the family was like, they know that I'm from another culture. I know they're from another culture. It was not like a scary, bad experience. They helped me, I'm helping them. And I've made the faux pas, but I have never had a family not be super kind about it. And I think what you're saying too is just, if you're going in with respect, then a faux pas will be forgiven.
No, thank you guys all for sharing that. And I think that it's important to see that there's a balance, right? There's a certain level of do your pre-work, know what family you're going into. And then there's also the other level of also learn from the family, because we are not a monolith. And right, just because you read somewhere that X, Y, and Z family or X, Y, and Z faith operates X, Y, and Z way, doesn't mean that all the families you meet are going to fit in that curated box that you think exists, because it doesn't. And so that's why it's do your research, but check yourself when you get into the door and come in with an open mind of like, you may not be what I read. You may be completely different from that. And that's the whole point, is that we're centering our families, right? Like we're learning from them. We're also recognizing the access that they bring into the communities. I remember when I used to do home visits, there would be always something new that I would learn about my families. One of our family members, she couldn't come into the school because of a disability, that made it difficult for her. But she was actually an author. She wrote books. She was, she had so much to offer. And so that was like a point of a conversation, right? Or another family who they had like an artist and things like that. And so like, how can we also go into that space to like, I learned a little bit about your culture, but really I'm coming here to learn from you. And then I'm seeing the assets that you bring into the space wherever you want to share. And so also thinking about it of like, it's what families want to share and let them decide what that looks like, rather than like, as Carrie said, having like a list of, yes, I know there's sometimes things that we want to hopefully establish or learn about those families, but also be open to like, it may not be how you want it to go. It may not even be the answers that you were hoping for, but it may be completely different. But that is how you build the trust and the relationship. And through multiple times of conversing and meeting with this family, you'll get the impact that you want to have, but really setting it into like, what do you want to share with me? What do I know? How do I really learn about your assets and bring that up into this space? And so just take that into consideration as you're doing home visits, especially when you're thinking about this background of youth and families. With that, go ahead.
Oh, I just was going to say, Sabrina, I so agree. And I do tell, like Gina says, I have a lot of colleagues that are worried about this very thing. And in addition to everything I already said, I say that exact same thing, which is, you can't know every single detail about every single culture in the world, but you can build a relationship with this family. And if somebody heard that I was American and assumed that that meant all of the American things, they would be pretty surprised, because there's a lot that I do that's not going to be listed in American culture. So definitely that agreed, as Gina also mentioned, like awareness, but not like imposing expectations onto a family and not worrying, not being scared of it.
100%. Going to our last question before we jump to Q&A, which is, can you describe any challenges or barriers you all have encountered when implementing home visits and how you've overcame them?
Can you say that again, Sabrina? I'm sorry.
So just talk about like any challenges that you all have encountered when you're conducting home visits and how you've overcame them.
Oh. Wow. So, and this wasn't an immigrant family, but this is the first story that popped into my head. So I went to go conduct a home visit for a young man. This was during COVID. He wasn't showing up for virtual learning. And I got there, I encountered the student, the dad, and the grandmother. And grandma was doing all of the talking in the cane swing, the cane swinging. I explained to her my purpose of the visit was related to him being absent from school, and we just wanted to see what was going on, how the school could be supportive. We found out that the student attempted to enroll or in this specialty school and did not make the cut. I mean, grandma was upset about that. So she was very aggressive, and I'm smiling because she used some very colorful language, but it was an opportunity for me to, establish my purpose for being there, was to find out what the issue was. And she highlighted that. And it was okay that she was upset. And the fact that she was upset showed me that she loved her grandson that much that she was willing to go to the ends of earth to ensure that he had the best educational experience. And so what I did was partner with the dad. The dad was saying, hey, mom, he's here to help. But we stopped making it about them and opened it up to focus it on the student and then ask the student directly what's going on, right? So oftentimes when we're doing these home visits, the parents start doing all of the talking because they feel as though that they are the most intelligent, right? When no, students have the intelligence to be able to communicate about their specific needs. So I look at leadership as a process and not a position. So even though my position as a parent of my 7-year-old child, I can't always speak to his needs directly. He has to have the opportunity to speak up for himself. So during that home visit, shifting the attention from grandma and her aggressiveness to the student's needs helped me get the opportunity to identify the barrier and then get the student connected to what he needed so that he can move forward and fully engage in school.
I think, yeah, just always identifying you have a common goal, like find that common goal and make sure that's communicated. And I think that's a really good way to overcome those kinds of misunderstandings or conflicts. I agree.
Can I say grandma was really going to hit me with her cane? Like it was real. I made it out alive.
I think that with a lot of the pre-work that we've talked so much about, like that really sort of just removes a lot of the challenges and barriers that you might imagine. I think that when I was reflecting on how I would answer this question, because I don't really I just love them. Like I can't think of anything that's scary or bad, or I just love it. I just love it. But I think that what could be a challenge for folks is going into another person's home, another family's home, and it is different than your own. And not feeling judgment and not feeling pity around that either. Newcomers especially, they might not really have furniture. A lot of my immigrant families eat off the floor anyway, because that's culturally what they would do. I don't go in there and think, oh, this poor family, they don't have any chairs. And I think that that is something that it would be human to fall into, but I think that's going to create barriers with the trust and rapport. And so really going in open-minded and not judgmental, and there's no pity. It's absolutely asset-based, as many people have already mentioned. What are the strengths that this family brings? What did they put up on the wall? That was the one thing that they had. Oh my God, I can't believe how beautiful this thing is that you brought all the way from Eritrea. Like, this is amazing. Asset-based absolutely can help overcome that.
Yeah, I'll just add to that. I agree with both Mike and Carrie. Excuse me. I think that a lot of the challenges that I hear from home visitors across the country have more to do with their own expectations than with what's kind of actually happening with the family or anything. And so I might hear some home visitors kind of come back from a home visit and be very surprised by what they saw and are still trying to process that. And what does that mean, right? To the examples that Carrie gave about, a home that maybe is very different from one's own home. And, how do you interpret that going into seeing that for the first time? Also, I've heard some educators talk about going into a home visit where they were very excited to learn about the family and, learn their story and all of that. And it turns out that the family was not ready at that time to share very much. And so the home visit didn't last very long. And that's okay. Like we tell our educators, that's okay. The family shared as much as they were willing to in that moment. And that's a start to an ongoing relationship. So I think it has a lot to do with the educator's own expectations about what they're going to find in a home visit.
I thank you so much for saying that. It's literally what I had written in my notes is expectations. But something you said is really important, which is think about what you're asking. So we have a really large influx of families from Venezuela coming in this month. And a colleague said, oh, well, I'm going to see what their Spanish literacy level is by asking them about the trip from Venezuela to Denver. And I couldn't really think of a worse question. It's just not trauma informed. And so going to a home visit, same thing. I'm not going in and saying, wow, would you tell me about the Taliban and what was the worst thing you saw? Did you ever see anybody get shot? Like that's triggering. That's not trauma informed. So being open to a family sharing that, absolutely. But I'm not going in there and interrogating a family about their lives, their challenge. Like, it's not an interrogation. If I want to learn about the Afghanistan conflict, I can look online. I don't need to ask them about their personal experience, because that is definitely not going to build trust and rapport.
No, 100%. Thank you all for sharing that. I think it's really important that oftentimes the challenge is within us and not necessarily the families. And so I think it goes back to like, check your biases before you go into the door, right? Like don't go, you're going to have perceptions about this family and things like that. And that's real. We're human. But like, how do you check yourself so that you also are not recreating harm? Right? Because as we think about home visits, right? Like if a family had a bad experience, conducting an adult, like someone in the education space coming into their home and it wasn't great, that can be a big reason why they probably never let anyone else come into their home. And so, especially when we're thinking about newcomer families that have just migrated, like you are setting the stage around what the education space looks like. And so be very, very mindful of that. Because that first interaction is so important. And I think it goes to even Gina, when you were talking about the model that you all use of like, how do we center our families around their hopes, dreams, right? So it's not about us. We're not going there because, we were told by the school, such and such student is having bad attendance. So I'm going there to figure out what's going on. That's the end goal, right? But that is not what your first conversation is. That's not what that first, interaction looks like. It's really about trying to understand and learn about this family. It's really trying to, center like, well, what are your hopes and dreams for your child? And then using that as an opportunity to be like, okay, so how can we actually if this is what you hope for your child, right? Like, how can we work together to get there? And so I think it goes from just the beginning of a conversation of like shifting how home visits are in terms of how do we see it as a partnership and not necessarily something that's transactional or punitive, but really we see value in our parents and they all have hopes and dreams for their kids, right? And our job is to support and help them actually come into vision. So thank you guys for sharing that.
Can I add something, Susie?
Yes.
Sabrina, I'm thinking about highlighting one of the participants. I didn't know that she was going to be here. So we had Susie Estrada from the state of Utah. I've been conducting home visit training for them because what they're doing is visiting all of their students to increase a sense of belonging. So now we're going, so you know how we want to make the first phone call positive? They want to make the first home visit, positive so that they can build that foundation of trust. And I think that is such a wonderful practice. And, something that I kind of gush over all the time, every time Susie and I connect is like, I can't believe that you all are actually putting so many resources into making sure that every student is visited and that they have a positive first in-person interaction with a teacher at their school.
100. Go ahead, Carrie.
I was going to connect that. I totally agree. Like if I could visit every family twice a year, I absolutely would. But as Gina mentioned, one of the non-negotiables for the parent-teacher home visit program is that it's optional for everybody. The goal is that as many people participate as possible, but there are families that just are like, nope, no thanks. I explain, this is what it's like. Your neighbor had me over, whatever. But there's like, no. And I think that goes to, Claudia had a really good point in the chat, which was we're mandated reporters. And so I just can say in my personal experience that if I'm getting permission from the family to come, I have never seen something that I had to report. Not ever. Usually that family's probably just going to say no. But I do agree that if you do go into a home and there's actually neglect or other serious concerns, which is different than not having a lot of material items yet, that is definitely something I wanted to highlight as well, because we don't want to overlook that.
Thank you all for sharing that. Thank you guys for just giving us a wealth of knowledge today around this topic, right? And with that, I know we got a few questions in the Q&A box. So I'm going to actually turn it over to Anthony to moderate the Q&A section of the webinar.
Thank you, Sabrina. And yes, I will piggyback on your thank you to all of you, Gina, Carrie, Dr. Gary. This has been amazing. Watching the chat just kind of blow up in a really good way. It's been an amazing conversation. And we do have a number of questions that have come in, and definitely want to get to as many of these as we have time for. We've got about 15 minutes here. The first one I want to hit on is one that I saw asked in a couple of different ways. And it's basically, going into the home visits, you've got the student, you got the younger person, but you also have the family there. And so the questions that came in were, do you kind of concentrate the visit on the student, or do you kind of make it for the whole family? Can one of you or any of you, all of you, speak to kind of the model for what those actually look like?
So for us, we're considering, and I think the first question was, what does it look like for high school students, right? So we know that, and at the elementary school level, the parents' influence on the students' engagement is higher than what it is when we're talking about high school students, right? So while we're going to keep the student always at the center, we try to make sure we enter understanding who is going to have the ability to do most of the talking. So when we've done home visits for pre-K kids that were disengaged or not showing up for school, I'm not talking too much to the baby. I'm talking a lot more to the parent, and I'm identifying the barriers that live in that space. But when I'm in high school, we can have a student that's disengaged and the parent doesn't know at all, right? So we want to make sure that we create opportunities for the student to feel empowered to share what's going on in a non-punitive way. I'm thinking of a home visit for an elementary school student where I knocked on the door and mom didn't want to come down. She said this was her day off. And so I said to the student, well, you haven't been in school. Is everything okay? And he said, well, I don't like coming to school. We've all heard this before. So we asked the easy probing question, well, why don't you like school? He tells us what we expect. I don't like my teacher. I asked why. He said, because my teacher makes me read. And I said, well, why don't you like reading? And he said, because I don't read well. And I asked him, well, who did you tell? And he said, no one. And I asked him why. And he said, because I didn't want to get in trouble by my mom, right? So it was a good thing in this case that mom wasn't there, because the student had opportunity to tell me what's going on with him, and that he's struggling with reading, and that he's being called to read in front of the classroom, and it makes him uncomfortable. So I asked him, I said, well, why did you tell me? He said, because you can't do nothing to me. And I was like, well, good, I could do something for you, and connected him with support at the school in a way that he wouldn't get in trouble with his mom. So you have to, be flexible in your approach, having a good understanding, again, of what you're entering in as much as you can, so that you know where you're going to be targeting your conversation during the home visit.
I just want to speak.
Five wise. Yeah, Janice. Janice has been in the chat.
I just wanted to say really quickly about engaging students and or families during the home visit. And just the one kind of specific point I want to make is about the hopes and dreams question. And we find that to be incredibly powerful, not only to ask the family what their hopes and dreams are for the child, but to ask the child or the student what their hopes and dreams are. And a lot of times we find that that's the very first time that the family has heard the expressed hopes and dreams of the student, and vice versa. It's the first time sometimes that the student has heard what their family's hopes and dreams are. And so it becomes a very powerful moment to engage everybody in the room in sharing hopes and dreams and creating this big vision for where we can go together as partners. I also need to say very quickly that I have to run right now to get to the airport to catch a flight, but thank you so much for this opportunity to share and to learn. So I will see some of you soon.
Enjoy the conference,
Thank
Gina.
Safe travels.
There.
I will have a one-sentence answer to that, which is, well, hopefully one. In my personal experience, I have a relationship with the student. It could be strengthened, but I already have a relationship with the student. So I am there to build trust, rapport, relationship with the entire family, and the student is a part of the entire family. So my answer is yes.
And one thing I just wanted to quickly add on to that particular question is that as you're conducting home visits, right? Like, I think in what it ends up happening that it's both for the students and for the families. And so you're coming in to ask, like, not just the parents' hopes and dreams and the students, but also at the same time, right? Like, if the parent is struggling with X, Y, and Z, oftentimes that's also impacting the student and their ability to learn. And so even with home visits, it's an opportunity to also learn about the families. It's oftentimes even like, I remember that I used to conduct home visits, and it would be like my student, like I'm working with a student, and they, they want to play a sport, so they have to like do the physical. The school's able to do the physical, but the family doesn't have the transportation to even come to the school to do the physical. And I wouldn't have known that if it wasn't for the home visit and building that relationship with the parent. Therefore, then I'm able to ensure to provide and support to create that, transportation service so that the student can play the sport that she wanted to play, but then helping the parent to actually show up to do that. And so I do think it's important that, like, within these home visits, like, it's also an opportunity to learn about the things and the needs that the families want and figuring out ways to provide those resources, because oftentimes by helping the families, you're also helping the student.
Great. Thank you all so much for contributing to that one. That was again, one that came up in several different individuals. So thank you for answering that. Another one that's come up in a couple of different questions here is if you've had experience with kind of partnering with refugee settlements or resettlement services or community-based organizations who are also doing their home visits. And is there a way, or if you've had any sort of participation in kind of fostering those visits together or kind of supporting each other in those efforts?
So we have not worked directly with any of those types of organizations. What we typically do is after we go and explore the community that we serve and have conversations with the district, we try to hire staff that are representative of the communities that we are supporting as best to our ability, right? So, they're already culturally aware when they're entering into this space where they're going to be doing home visits, because in every environment, there's not always an organization available. And then in our case, we are the organization that's being brought in to extend the reach of the school district. So I think that might be best answered by somebody that works directly in the schools that don't use Concentric for their home visits.
I mean, just for succinctness, because there's so many different questions and we're running short on time, I will just say that I think the purposes of those refugees organizations' home visits and the school's purpose for the home visits are not really usually aligned. The answer is no, I haven't really worked with them specifically around home visits. We partner in other ways in meeting the family's needs with wraparound services, but not specifically with home visits.
And I can speak, when I worked at a community-based organization, we did conduct home visits. And it was mandatory to actually, have our students participate in the program, but it wasn't in relationship with the school per se. And so I think it just really depends on how various community-based organizations operate. Though I will say, I think there is a need and importance to have kind of like that partnership both with the schools and the community-based organizations, which I think it went to like the beginning of this conversation of like, if it is a teacher that's conducting a home visit, how can they bring in an advocate? Someone that works at a community-based organization who already does this and has that relationship to be present in those meetings. And I think that's where relationship, and it's not just mapping out what you should know about the student, but also mapping out the resources in your community as an educator and how can you build on that and, have that also support you in doing this work for, at the end of the day, for student outcomes and to ensure that students are successful.
Thanks, Sabrina. Appreciate that. Another question that's again coming in different from different attendees here, and I'll preface by saying that we are actually doing another webinar. This is part of a series that we are putting together. This is going to be a few months down the road yet, actually into 2024, but specifically working with young individuals who have some sort of a disability. And so we're going to really target that in this one webinar. But to that point, we've had some questions come in, and again, I'll let Carrie or Dr. Gary or Sabrina respond to these if you would like to. But in terms of working with families who have children who have some sort of a disability, whether it be physical or developmental, does that then change the way the home visit looks? Is there a different way to approach that? Any thoughts or experience you can share about that?
It doesn't change my approach at all, right? A student is a student, their needs differ, right? So I'm typically in those cases, I might know in advance. In our home visit and student engagement app, we're able to identify whether or not a student has a file for or IEP. So we can know on the front end, but there are home visits where we don't know. I remember I was knocking on the door, no one answered, and as I was going back to the car, I heard somebody honk at me from the corner, and it was the aunt of the student. And she shared with me that she was frustrated with her mother because they could not get her nephew the support that he needed, and dad had left to take the other baby to get some Pampers. And what I learned is that this student had epilepsy and blood on his spine, so he really was having some health challenges and needed to have the home and hospital experience and wasn't able to get that completed for whatever reason. They couldn't get in contact with the school. It just wasn't working. But through that experience, I had the opportunity to just call the principal on the spot, connect the principal with grandmom, and then resolve the issue. I think when we're dealing with students with different needs, the whole point is to really make sure that we have a good understanding of what their needs are and that we're trying to connect them to the resources that are going to be best for them. So for me, no, I'm not changing my approach because I'm going there to explore and to understand and to offer opportunities for support. And if I do that at every home visit, then I don't have to make any special considerations because I'm coming with my arms and my heart open, ready to receive any encounter that is going to be before me.
I agree, absolutely. And I had actually tried to respond to Erica, was one of those that asked that question in the chat, and I realized that I sent it to the wrong. I sent it to myself instead of to everyone. But anyway, I've had newcomer students with some really significant needs and disabilities, including cerebral palsy. And I think it's absolutely the same in the sense of I'm learning about your family. Your family is special, asset-based, open-minded. I really encourage everyone who does home visits or works with kids in general, to work on their strength-based talk. So I hear so often in IEP meetings, what are his strengths? Well, his strengths are Minecraft. And that might be an interest, but I guarantee that kid has more strengths than that. Dig deeper, even if it's something that has been labeled as negative. For example, we might say a kid is manipulative. The strength side of that is that the student is great at advocating for their needs. Can we help them do it in a more positive way? Yes, but really looking at that asset-based attitude, that's not different between students with disabilities, IEP 504s, and the rest of the home visits.
Excellent. Thank you. Thank you for answering that. Again, it did come up several times, so appreciate that. And again, to everyone, we will be doing a webinar coming up in the next few months dedicated specifically to that. This has been, again, an amazing conversation. Thank you both so much for participating. We still have more questions that we unfortunately aren't able to get to. One thing I will share with everyone is all of our speakers have been gracious enough to allow me to share their contact information as part of the follow-up. So that will be included in the post-webinar email that will be sent out later this week, along with the recording and a copy of the slides that Gina presented as well. So you'll all receive that. But before we do close out, Dr. Gary and Carrie, that was a good rhyme. I'm going to open it up to each of you and see if you would like to give any kind of closing comments or thoughts around that. And then Sabrina, let you do the same.
I guess it's on me to go first. Look, again, home visits aren't a new thing. I just hope that when you're using them as an intervention, that they're purposeful. You're not walking into any situation blindly, that you all have a good way to document the outcomes so that you can use the information you learn to develop prevention or preventative approaches to supporting your students. We often are responsive to the early warning indicators, but there's a lot of information that we can capture during home visits to be used in the future so that we can develop better supports. And, if you do that, I think that we're using the home visit as an intervention appropriately. And, the students and the school environment will benefit from home visits being used as an intervention. Thank you.
I just want to say, I think home visits have absolutely improved my practice as an educator. I recommend it for everybody, especially with the parent-teacher home visit. Non-negotiables that Gina went over: be authentic. And if you can come in with an authentic curiosity about the family and the student, and with authentic joy for the honor of being in this family's home, I think you're going to have a great time.
And I would say, be open-minded and really center the power of relationships. It's not meant to be transactional. It's not meant to be punitive. I know I've said this, but truly it is not. It is meant to build a relationship with your families so that we can support our students so that they're successful. And so really think of it at that and let the foundation of it all be built on trust and relationships, and the rest will work itself out. But with that, I also wanted to thank our amazing panelists today for sharing their wisdom and knowledge with us on really the power of home visits in relation to specifically this population of youth and families. So thank you. I'll turn it over to you, Anthony, to close us out.
Thanks, Sabrina. Huge thank you to Sabrina, who has really been the mastermind behind bringing this incredible panel together. So thank you so much for leading that charge. And again, to Gina, to Carrie, to Dr. Gary as well. Thank you all so much. This has truly been an incredible conversation, and I appreciate all of you taking the time to do that. As I mentioned a little while ago, just a quick closing. You're going to get contact information, you're going to get slides, you're going to get the recording, you're going to get it all coming your way in the next few days. So be on the lookout for that. And as mentioned, this is part of a series that Sabrina and I are working on currently, and so we'll be sharing information with all of you as registrants of this webinar, so you'll know the ones that will be coming up here pretty soon. So look for that information as well. Thank you all for taking the time to hang out with us for the last 90 minutes. It's gone so quickly, but it's been amazing. And once again, thank you all to everyone that spoke on the webinar today. We're so very grateful to you. Thank you all for the work you're doing each and every day in your communities to make everyone feel like they belong where they are. Thank you so much for that. Have a great afternoon, everyone. Have a great rest of the week. We'll see you soon. Bye-bye.
Bye-bye.